Hi, my name is Laura Stemmel. I'm a P3 pharmacy student at Duval College School of Pharmacy. Today I will be talking to you about my journal club article, which was based on zinc for childhood diarrhea. They looked into lowering the dose to see what it would do. This was a randomized multi-center trial. I chose this article because natural products really interest me, and finding out more about natural products that can help children is a really good thing, rather than just giving them regular medicine. So the authors were Dingra, Keising, and Sudfeld. The source was the New England Journal of Medicine. The primary objective was to analyze whether or not lower doses of zinc would provide at least the same efficacy as the normal recommended dose of 20 milligrams. There were three primary outcomes considered in this study: the duration of diarrhea, the numbers of stools per day, these were per protocol non-inferiority analysis, and vomiting, which was an intent to treat superiority analysis. This study was a randomized, double-blinded, controlled trial of three groups of zinc, 5 milligrams, 10 milligrams, and 20 milligrams, to study the efficacy and safety profile of lower doses of zinc in pediatric patients. The subjects were children from 6 to 59 months who were suffering from diarrhea in the countries of Tanzania and India. The inclusion criteria were that the children were 6 to 59 months, they will likely stay in the study area for at least 2 months, they have acute diarrhea less than 3 days when they were screened, or dysentery, which is the visible blood in the stool, for less than 3 days at the time of screening. And they needed written informed consent from the patient's caretaker. The exclusion criteria included the presence of severe acute malnutrition, the parent's refusal for participation, a presence of severe dehydration that couldn't be corrected in 4 to 6 hours, and signs of severe pneumonia or sepsis, rapid diagnostic testing to confirm malaria or other severe illnesses. Not intending to remain in the study area for the duration of this study. The study period lasted 14 days with visits and diary reviews. These were done via phone call, clinic, or home, and on days 3, 5, 7, 10, and 15. The monitoring patients were monitored immediately after the dose of zinc was given for 30 minutes to measure the safety outcome of vomiting within 30 minutes of dose given. They were also recorded through a diary that the caretaker filled out. The diary included the dose, when the dose was given, the number of stools the patient had, and vomiting after 30 minutes of the dose given. The first two primary outcomes were diarrhea for more than 5 days and loose or watery stools. These were non-inferiority intent to treat analysis. The third primary outcome was vomiting, which was a superiority per protocol analysis. Power was set and met at 90% with a 0.05 significance level. The non-inferiority test was one-sided for mean stool number and duration of diarrhea, and the superiority test was two-sided for vomiting. The number of patients was 4,500 that were needed to meet power, and a total number of patients of 4,500 were assigned to this study. The data analyzed was the diarrhea for more than 5 days. This type of data was ratio. The test used was the Kaplan-Meier curve, and this was an appropriate test. The number of loose stools was the second data analyzed. This is also a ratio data type, and ANCOVA was used to test this analysis, and it was also appropriate. The third was vomiting within 30 minutes of zinc dose. The data type was nominal. The statistical test used was a binomial test, and this was appropriate. For the first primary outcome of diarrhea for more than 5 days, the 10 milligram and 5 milligram dose showed higher results of 7.7 and 7.2% respectively than the 20 milligram dose of zinc, with confidence interval of 98.75%. Both lower doses were below the margin of 4.4% non-inferiority, excuse me. The second primary outcome was of loose or watery stools were similar for the 20 milligram, which was 10.7, 10 milligram at 10.9, and 5 milligram at 10.8, with confidence interval of, again, 98.75%. These were also both below the margin of 4% non-inferiority. The third primary outcome of vomiting within 30 minutes of taking the dose occurred in all three study arms. 20 milligrams was 19.3%, 10 milligrams was 15.6%, and 5 milligrams was 13.7%. Both lower doses showed less vomiting than the higher dose of 20 milligrams of zinc. Zinc is a tolerable drug for diarrhea and is in fact used for diarrhea. This trial studies the effect of the lower dosing of 5 milligrams and 10 milligrams, so the tolerability showed to be even better compared to the agreed upon dose of 20 milligrams. The authors concluded that the lower dosing of zinc 5 milligrams and zinc 10 milligrams would not be inferior to zinc 20 milligrams and would have a better safety profile, meaning less vomiting for the patient, than the higher dose of 20 milligrams. The strengths of this study included that it was randomized, it was double-blinded, it was a multi-center, multi-country design, it was a large sample size, they had outpatient recruiting, and it studied an age gap group that the empiric dose of 20 milligrams doesn't necessarily cover and causes adverse events higher, like vomiting. The limitations of this study was that they were relying on the caregiver to report accurately. They have frequent communication, which battled this limitation though, so it lowered this limitation, I mean. And the other limitation was that the lower rate of severe diarrhea in children. The level of evidence. This study has a level 1 evidence, which means that the results are reliable and have minor limitations, which include the number of dropouts were not reported, the reasons were not provided for dropouts, and concurrent drug use was not discussed. I recommend the lower doses of 5 milligrams and 10 milligrams, which are not inferior to the agreed upon dose of 20 milligrams of zinc. The patients on 5 milligrams and 10 milligrams have less adverse events of vomiting than that of 20 milligrams within 30 minutes of giving the dose. For efficacy, zinc is already recognized as efficacious for diarrhea in pediatric patients. The lower dosing for safety shows less adverse events of vomiting in pediatric patients than the higher dose of 20 milligrams. The cost of zinc is low at 2 cents and 5 cents per tablet, and there are no special considerations or populations. Thank you very much for your time, and I hope you have an enjoyable day.